So if you were wondering what truly championing your healthcare looks like, listen to this story. I'm working with a new client, recently diagnosed with a chronic illness, and she's doing it alone. So she's very frustrated and fearful. And most importantly, she has been on the receiving end of a medical error. So she's rattled, she's confused. And one of the most important things that she's finding is when she goes to her different specialists, they don't always all have the information. She was halfway through an appointment through one of her providers actually knew her new diagnosis. Like, talk about frightening. So we've been working together on eliminating communication gaps between all these different specialists that she's seen here today. So really, what can we as patients do to make sure our doctors communicate better with one another? Lots of things. Some of the things that we've been working on is logistics, getting the patient portal set up, printing them out, having the information sent. Is it getting there in time? Are we following up? And most importantly, are we making sure the right piece of your health history is with the right physician before that visit? So I got to say, I was so excited. She called me after her most recent visit and said, hey, guess what? They wanted to do a lab panel. So they weren't happy about it, but I asked to sign the release forms before the blood draw. So I actually had to make them wait, but I wanted to make sure that was done so my lab results could get to all of my physicians. And I just can't help but think that is a perfect example of championing your healthcare. Healthcare isn't always set up to support what we need as patients, like in this example, making sure the release forms were signed in advance of a lab draw to make sure that information then was disseminated to all of her specialists. One thing we can all agree on, without the right knowledge and advocacy, we can't get the most important things done. So whether you're demanding a process change or you're questioning a care decision, it's your role as patient to say, hey, this is a bit outside my comfort zone. This doesn't feel right. We need to do something differently. So don't ever feel guilty about doing what's right for your health.